Hey everybody, this is John Oxley from Huntington Physical Therapy, doing my Friday tip of the week. This week I was going to talk more about the physical therapy experience that I discussed last week, dig in a little bit deeper, and then I had an epiphany. Many of you who know me know that I am moving houses this weekend. Please pray for me. And it occurred to me, I was thinking to myself, I'm going to have to be doing some back exercises so that my back is not a wreck on Monday. And what that brought to my attention was that many people out there don't know what they're supposed to be doing if they're going to have a big weekend of lifting, carrying, bending, weeding, yard work, moving, and the least that people think about is traveling. When you're riding in the car for a long period of time, you need to know what to do. So in this week's video, I'm going to discuss and show some things that you can do if, one, you're going to be doing a lot of lifting, carrying, sitting, and two, if you have an acute or a fresh back problem that creeps up while you're doing this stuff, what you can do to help yourself immediately. So hopefully this will be really informative this week, and then we'll get back to talking about the patient experience next week. First, let's talk about preventing the back pain from coming on if you're going to have a big traveling day or a big lifting and carrying day. We don't talk enough about prevention, we talk a lot about treatment, but this is an easy way to prevent some really common back problems. So everything we do is normally flexing, bending, lifting, so then it should make sense that we need to be going in the other direction. All you need to do every 20 or 30 minutes is you are going to stop, put your thumbs in your low back, bend backwards as far as you can. You're going to do this a couple, 4 or 5 times. It's probably going to hurt because you've been doing so much lifting and bending. You need to be doing that exercise approximately every 30 minutes when you're lifting, carrying, bending, or doing physical strenuous work. Now obviously you're not going to stop every 30 minutes when you're traveling, but each time you get out of the car when you're traveling, do some back bends, walk around, and do some back bends right before you get back into a car. Your back will thank you. Second thing I wanted to talk about today was, what do you do if you are bending, lifting, carrying, and you feel that pop in your low back? A lot of people have had it. They kind of describe it as the big one. You start to get that muscle spasm in your low back. You start to kind of lock up. Sometimes you'll get this kind of wash of pain down your legs. You feel like you're having the big low back problem. So first thing you're going to do is you are going to get down on your stomach. A lot of people want to crawl in the house and go sit in the chair. Do not sit down. It will make this problem worse. It will make the muscle spasm worse. After you lay down and you can get comfortable in this position flat, prop up on your elbows. This will allow you to kind of push into extension motion to relieve some of the symptoms. You may get some pain with this. In the long run, it's going to be good. If you can get comfortable in this position, you're then going to progress into a press up. You're really trying to work on pushing into extension to undo that flexing injury that you just had. Well, I hope that was some good information for you guys this week on what to do if you're having some back pain, if you're lifting, if you're carrying, if you have an acute issue. If you have any questions, please send them our way. We'll be happy to address them in the coming weeks.